I am passionate about skin. I've been passionate about skin for many, many years, so bear with me, I'm going to talk to you about skin, but I'm also going to talk about the young face and the structures underneath the skin. So, why do we talk about skin? We talk about skin because every single patient who walks into our clinic has got skin. Every single one of them, there's no question. And we often don't talk to them about their skin. We're often very focused on what it is they are asking us. And we need to look globally at what it is they're looking for. So why is our skin important? It's important because it's the boundary between us and everything else. Okay, it's there, it provides an external view of what's going on inside us. We've all looked at ourselves in the mirror when we are tired, maybe Sunday morning, we've been on our feet all day on Saturday and out for dinner, had a little bit too much to drink and we're tired and we've got sallowness and dark circles and things. So we know what's going on inside us by looking in the mirror. It's a visual reminder of what's going on, of past times, of how many birthdays we've been through. But where skin is concerned, prevention is better than cure. So we're talking about the young face. So we need to consider what we're doing with young skin. Now, the definition of young is interesting, and I've taken a sequence of photographs, actually of my son, in his youth, just looking at how his skin has changed. This was him aged 8. Isn't that gorgeous? You just want to squeeze those cheeks. They're really, really beautiful skin quality. Please excuse the Marmite that's on his chin. Then this is him a little bit older, okay, so now he's 10. Now, we're not treating these patients, I'm just looking at skin. And again, he's still got that plummy look, but he's just starting, perhaps, to get the odd little blemish. Very poor quality photograph, for which I apologize. I'm just making a point here. This is the age, okay, he's 13 at this point, and he's just realized there's a mirror, and I don't know whether you can see, it's a real smile. He's looking at himself in the mirror, he's grooming his hair, he's starting to think about his looks. And at about this time, something else starts to happen, and he starts to get some breakout. Now, fortunately for him, he's got a mum who knows a bit about skin, so we're keeping his acne under control, because he does suffer with acne if we don't keep looking after his skin. So prevention is better than cure. If he carries on using the products that he's using, his skin is going to carry on looking fabulous as he ages. And as this talk carries on over the years, I'm hoping to add him in age 20, 25, 30. Let's see. So skin is very, very important. But as we age, the fat pads change. So here we are at youth with fat pads. The bone structure hasn't changed, really watching the change as we age and seeing what's going on in the skin. But the optimal results you're going to get for anything that you're going to do with any of these ages of patients is to look at optimal skin fitness. Okay, so making sure that the canvas we're working with is perfect. We can move features around, we can stop the muscles working, but if the surface of the skin is not good quality, then the patient will not perceive the results in the same way. So this is really interesting data. This is from Mintel. This is US data rather than UK data. In age 35 to 44, we may not perceive as the young patient, but 35 to 44-year-olds, 94% of people are buying a moisturizer. That's a huge number. 89% of people are buying a cleanser, 84 and 83 for night and eye. Now, there will be people in this group, the 6% who are not in this group, rather, who are in this group. So we know that well over 94% of people are buying skincare. In your clinics, do you sell skincare to 94%? Do you sell skincare to 50% of your patients? 10% of your patients, okay? The patients who are coming in to see us are buying skincare. Where are they buying it from? If they're not buying it from us, then they're probably not getting the best advice. So they're there to talk to you about how they look. So let's talk to them about skincare. So that's when I mentioned earlier about using a cleanser from whatever range it is or ranges that you stock in your clinic to clean the skin. So when you're cleaning the skin prior to a procedure, you can explain why you're using what you're using and perhaps drop in that it's something that you have as a retail product. So what is the skin? I'm going to do this incredibly quickly because I know I'm teaching people to suck eggs, but here we are. The largest organ of the body, it weighs 4 kilograms, and it measures nearly 2 square meters. 3 core layers, the epidermis, the dermis, and the subcutaneous tissues. The subcutaneous tissues being the deepest, this is where we store fat, and the thickness depends on the amount of fat that we've got. The dermis, we know the structures here. We talked at the beginning of the day about male skins, okay, and the fact that around hair we've got more oil in the skin. Remember also that you've actually got the structure. It's almost like a grid in the skin of hair in the male skin that helps support the skin, which is why we get less wrinkles in the perioral area. The dermis is made up of collagen, of elastic fibers, of glycosaminoglycans. Okay, so lots of things going on in the skin that we've already talked about. And then we have the epidermis. Now, the epidermis is really interesting. There are two areas of the epidermis that are critical. First of all, the stratum corneum, and then the stratum basale. The stratum corneum is critical in terms of skin barrier function. Okay, but the older we get, the more stratum corneum we have, the thicker it gets. And that's where we get the resurfacing ingredients, so the vitamin C, the vitamin A, the retinols, and the hydroxy acids to resurface the skin. Down here, we've got the stratum basale. The healthier your cells are here, the healthier they will be as they travel up through the skin from the young stratum basale to the old stratum corneum. Now, when we talk about skin aging, there are two different concepts. One is how old is the patient that we're treating? Okay, so I'm going to use me as an example. I'm in my mid-50s, so my skin should look like that of somebody in their mid-50s. Then we need to think about this journey from young to old. The percentage change from 26 days to 30 days old of the surface cells is going to make a huge percentage difference in how old the skin looks. Okay, do you see the logic there? So if we can speed up the keratinization process, if we can speed up the journey from stratum basale to stratum corneum, we can have a younger looking skin cell. When we're treating our patients, we obviously need to be very cognizant of the Fitzpatrick scale. I'm not going to go into it in any depth. The comment I will make today is very important, that with the Fitzpatrick skin scale, we have to look at this side here. Always burns through to rarely burns and tans with ease. Don't think color, okay? Because we have so many changes going on in this now, because you can have a Fitzpatrick type 1 skin that because of mixed race is really very robust and really fits somewhere around Fitzpatrick 3. And there's an awful lot of great clinical data out there, a lot of new research going on in that area. So do go and find out what you can. So let's look at what happens in a young skin. What sort of things are we talking about? We're talking about fine lines. We may be talking about wrinkles. If somebody who is under 30 has got fine lines and wrinkles, let's look at their lifestyle, because there may be things we want to do to change there. Maybe they're a smoker. Maybe they don't sleep enough. Maybe they don't drink enough water. Maybe they need to look at their diet. There's lots of other things we can talk to them about. Age spots possibly beginning to creep in, maybe if there's somebody who's a sun worshipper particularly. Irregular pigmentation, maybe because of hormone changes, maybe because of sun damage, maybe post-inflammatory hyperpigmentation. We need to look for these things. Uneven texture and tone. Most people will have uneven texture and tone if they're not using the right skincare at this age. Dryness. We've already talked about dryness and the difference between oil dry and water dry, but so important to make sure we've got plenty of hydration in the skin. Patients think consumers, they're the same. Okay, consumers think that a dry skin needs grease. Okay, so they go and buy greasy products and pile them onto their skin. That's not really going to increase the water content sufficiently. What we need to do is to stimulate the skin to make more hyaluronic acid and increase the water from the inside. Rough surface. Yes, we know we can reduce the rough surface. I'm going to show you some great photos in a minute. Visible pores. If we can increase the hyaluronic acid content of the skin, increase collagen in the skin, plump the skin, that's going to close down the pores. That's going to give a very immediate, very real result. Telangiectasias, what are we going to do for that? Asymmetry. Asymmetry and balance changes in the young face. So the treatment objectives is to maintain optimal skin fitness. Okay. I use the word skin fitness, not skin health, when I talk to patients, because to me, if somebody talks about health, we think about the National Health Service. We think about going to see our doctor because we are unwell. If you have a conversation with somebody about fitness, they get really enigmatic, really sort of energized, because they're going to go to the gym to get fit, or they're going to go for a run or a swim or whatever. Fitness is something we take upon ourselves. So if you use the phrase skin fitness with your patients, you'll find that they're very engaged, very interested in what we're talking about. We want to protect against premature aging, so ingredients in the skin that protect against photo damage. And there's vast wealths of published clinical data on ingredients can do that, as well, of course, as your sun protection factors, particularly now looking at the physical sun protection factors. There have been 2 very interesting recent papers on the dangers of chemical sun protection factors, some great studies there. Skin barrier strengthening. Now, I'm going to talk about a myth. There's a myth that alpha hydroxy acids thin the skin. Okay? Raise your hands if how many people know about glycolic acid thinning the skin. Okay? It happens. Glycolic acid is supposed to thin the skin. It's a myth. There's a clinical paper, Dr. Dietrich, published in 2004, fabulous clinical paper that shows that alpha hydroxy acids thin the stratum corneum. Now, that's a good thing. Okay? We want to take away the excess stratum corneum. But that same paper also showed that you increase skin thickness, so epidermal thickness and dermal thickness, by between 16 and 25%, depending on the dose of glycolic acid you're using. That's thickening the skin, and that is a good thing. So in total, glycolic acid thickens the skin, but it reduces the stratum corneum, which we want it to do. Unfortunately, that got picked up by a journalist who only read the stratum corneum bit, and there was a massive, in the paper I mentioned earlier, which is not a clinical paper, the Daily Mail published that glycolic acid thins the skin, and I'm afraid it's a myth which gets picked up time and time again. Collagen boosting. So Uliana was talking about vitamin C as a collagen booster, retinol as a collagen booster. We have neoglucosamine as a collagen booster, N-acetyltyrosinamide, dozens of different ingredients, including some peptides that do really good things in terms of collagen boosting. Skin nutrition. Always talk skin nutrition with your patients. We haven't got time to cover it today. And make sure that you're enhancing natural features, not moving things around. I remember a patient coming to me, and she was a very pretty young girl. She brought in a picture of Michelle Pfeiffer and asked to look like that. I'm afraid the answer was no. So my personal motto with patients is just say no, okay? And treat early niggly lines. How do we do these things? Baby Botox, botulinum toxin, medical needling, skin boosters, mesotherapy, lasers, lip enhancement, peel treatments, and professional skincare. All of these things are what we would have as kind of in the front line of our armamentarium when we're treating the younger skin. So, what can we achieve? Here we have the skin, okay? What is it we want to achieve first? And then we'll look at some slides with some really great biopsies of what we can actually achieve. So firstly, we want to exfoliate the skin. We want to smooth the skin, increase the luminosity. We want to keep those pores clear, because remember with the process of acne, if we've got dead cells from the stratum corneum falling into the skin, into the pores, they're going to congest, and that's where we get P. acnes building up. We want to increase the cell turnover to make the skin look younger. We want to even pigment. We want to enhance clarity. I'm not going to read the slide. You can see all the things we want to do. One of my favorite things to do is to put ingredients in the skin which help the barrier between the epidermis and the dermis, so that junction of the two. We call it the REAT pattern. And the REAT pattern is like Velcro that links the epidermis and the dermis together. Okay, so they link together, they hold as one, and the skin looks young. If you lose the REAT pattern, so we're talking about this wiggly bit here, if you lose that Velcro, the REAT pattern, then the skin layers can slide against each other. You often see that in patients in the necks before you see it anywhere else. It's a really, really aging fact of the skin, so we really want to link that back together. And of course, we want to plump the extracellular matrix here. We want more hyaluronic acid, we want more glycosaminoglycans, more collagen, and better elastic fibers. So let's see what we can do with ingredients. You can see here a thin epidermis and an almost complete absence of the REAT pattern. Here, we have a significantly thicker epidermis. Even if you look at this section here, which is the thinnest part of the new epidermis, here you have the REAT patterns coming back, and a much, much thicker skin. Now, this is courtesy of Neostrata Company. This is glycolic acid having been used for 12 weeks. Here from the same study, they've looked at the globular elastotic fibers. They're not working properly. We've not got the stretch. Here, the fibers, the elastic fibers, are much longer. This is how they're supposed to be. This has actually been borrowed a couple of times by dermatologists giving lectures saying that this is young elastic fibers and these are old elastic fibers. We've asked them not to do that. This is post-treatment with glycolic acid. Uliana touched on the polyhydroxy acids and the bionic hydroxy acids earlier on. So this is the third generation bionic polyhydroxy acid. And you can see here the epidermis significantly thicker. And look at the stratum corneum, fabulous effects on the stratum corneum. Interestingly, lactobionic acid is actually used because of its antioxidant and metal chelation properties. It's used in the washes that we use in transplant surgery to stop the breakdown of the organ which is being removed for transplant. Translating that into patients, here we've got the eye area. Okay, treating the upper eyelid is very difficult. We can't put Botox in there, we don't really fill it. But this is a topical ingredient, single ingredient, this isn't a product. And look at the difference here. And this is from a published clinical study. If anybody wants any of these studies, please do ask us afterwards. And here again, looking at the young skin, we've got N-acetylglucosamine, neoglucosamine, being used to reduce lesion count here. Okay, and this was in a study comparing versus benzoyl peroxide, again, published and available to you. Just a little sneak preview of an ingredient here, N-acetyltyrosininamide, that's been used topically on the nasolabial. Okay, this is just one single ingredient as a topical for nasolabials, and that's 12 weeks again. And we have ingredients as well that we can use to reduce redness. So this is a Visia picture of somebody. You can see the vascularity here. And this is at week 2, week 6, and week 12. So these are conditions that we'll see with a younger patient that we can manage with topical products. Here we have peeling going on and skincare products. Okay, so this is a 29-year-old female, so a nice young patient, and she's had one treatment of Easy TCA a week for 4 weeks with 4 TCA treatments in total. Phenomenal results. Another patient, also another young patient, again treated with TCA, and on this occasion again 4 TCA treatments with purifying cream and some protection factor post-treatment as well. So what can we do to achieve all of these different results? So we've got light, we've got lasers, we've got HIFU, we've got RF, I'm not going to list everything. If you walk outside onto the floor, you'll see all the different modalities out there. We can do skincare and peels, injections, mesotherapy, needling, putting ingredients in with treatments, with protocols, with equipment that will drive ingredients into the skin. And I love this phrase, direct dermal nutrition. So there are so many different modalities we can use, so many different ingredients that we can use to drive into the skin the ingredients that our skin needs to function as fitly as possible. So optimal skin fitness. So the conclusion is that with advanced clinically proven ingredients, we can improve skin health, skin quality, skin fitness. This is the starting point for any patient. As soon as a patient comes into clinic, this is what we need to be talking about. Something that is a complement to everything else that we're doing, but it underpins you as the expert. So that figure back at the beginning of the presentation, about 94% of our patients buying a moisturizer, if they perceive you as the expert in skin, they'll buy it from you. And that's a good thing for your business.